Lankesh, you are a filmmaker, and I understand that people going under the. All right, before I come to you, I have a caller from Mangalore. I'm going to put my question to you, but let me take my caller from Mangalore. Rohit, go ahead, please.
Good evening,
Good,
Shreya
eve-
ji.
good evening, Rohit. Why don't you lower the volume of your television screen? That way we'll be able
Yeah,
to
I
hear
lowered
you
it
better.
down. Yeah,
Okay, go ahead.
I studied in a Brahmin college in Mangalore.
Uh-huh.
It's a Canara college. There is a lot of ragging happening, just like Chetana's college in Bangalore.
Okay.
I
Okay.
don't understand why still people, untouchables, can't get justice.
Okay, okay. Your issue is different. You're talking about ragging, and I promise some other time we are going to talk about ragging, Rohit. But thank you very much for calling us. That's not what we are discussing today. But ragging is a problem. And if someone is ragging you, I hope you know that there are anti-ragging guidelines that are in place in this country. It's a serious issue. There are guidelines in place. Take those guidelines and show them to your principal. I hope he or she will be able to help. Dr. Mohan, you're calling us from Mumbai. Please go ahead.
Calling you from Mumbai, madam. Good evening to you all. I do entirely agree that today there is so much of advertisement and so much of social peers as well as your all this media, Instagram, etc. But all said and done, the patients need to be given to understand the difference between the need and the want. It is at the discretion of the doctor who has to put his foot down and explain things to the patient. Patients have Google as their university. They read from Google, WhatsApp, etc. Come and ask you to do it. And doctors today, because it's become too much commercialized and everyone wants to exist and they want to make money, and this is what is happening. This is totally rubbish. Unless and until we have stringent laws for this, this will only increase.
And
And
you
as
need
a
to.
practicing cosmetic dentist for the last 43 years, I've been practicing in Mumbai, and I can tell you something, that this advertisement things, etc., are becoming rampant. People are getting carried away. It is the doctors who have to make the patients understand. It is the onus is on the doctors, but they cannot say, I said this to the patient, but the patient insisted, and patient went ahead with it, and now this is what, see, the family has lost a child.
True.
I would say a child, according to me, maybe 21, but she might not like it. But I do agree. But for me, a 21-year-old girl is a child.
Sure.
It's a jewel of the house, whatever it is.
And you know,
Right?
the
It is the
fact is,
responsibility.
I agree. And the fact is, you talked about social media. Indrajit Lankesh, come in here. You're a filmmaker. For Chethana Raj, what did she do? She saw something on YouTube. She saw a film on liposuction on YouTube and decided this is what she wanted. And it was absolutely and perfectly easy for her to walk into this clinic in Bangalore and get it done. She obviously knew that, you know, what she was doing would not be okay with her parents, which is why she didn't tell her parents. Does the film industry, you know, the fact is we're talking about the film industry because you see actors and actresses looking one way 1 week, and suddenly next week there is, you know, there is something that has altered in their appearance. So clearly many of them are going under the knife. Many of them are looking at doing liposuction. No one speaks about it. In fact, I think Shruti Hassan is someone, an actor who has openly spoken about it and how, you know, these unrealistic standards of beauty are pushing even someone like her to a sense of insecurity. Does the film industry take blame for setting these standards that push these young girls to go for something like cosmetic surgery? You know, it's perfectly legitimate.
Absolutely.
But where is the need?
No, absolutely. First of all, my condolences to their family, Chethana Raj's father. I, in fact, was listening to him. He was talking about how 3 liters of fat was drawn from her body, and suddenly she developed breathlessness, and she lost her life. I feel sorry for Chethana Raj's family, and yeah, as you said, absolutely. You know, me being a filmmaker, I've seen a lot of actresses going under the knife, and as you said, a lot of actresses, like 24 hours back, they'll be in a different shape, and 24 hours later, they'll be in a different shape for a song or for a shoot. You know, they are definitely going under the knife. And in fact, I personally know a lot of actresses who have gone into this liposuction, who's gone into this bariatric surgery, and the challenges, the pressures, and as a caller rightfully said, there's a lot of pressure from the advertisements and especially from the social media today. There's a lot of trolls, there's a lot of comments.
Yeah.
You just put on a couple of kgs weight, there are a lot of trolls. And the main important point is Chetana Raj was a TV actress. She was acting in 2 TV serials, and especially in the television today, especially in regional cinema and television, it's booming. And they're shooting 24/7. They're shooting for couple of episodes, 3 episodes a day, and then no sleep, lack of sleep, no exercise. In fact, I suggest as a director, as a filmmaker, and generally as a society person in the society, why don't you work out? Why don't you be healthy? Why don't you be fit instead of going into this bariatric surgery, which is, of course, there's doctors in a panel that is meant for diabetes and liposuction, as we said, like recently, Mystery Mukherjee, we lost her. She's a celebrity and an actress. And Vivek Shok was my friend who's acted in a film with me. In fact, we lost him. He's acted in a lot of Bollywood films with Akshay Kumar and the likes. And of course, a very popular and successful actress, Aarti Agarwal, she went on the knife. She went into liposuction and we lost her. She was very successful down south. So a lot of these actresses, in fact, I personally know, instead of working hard or working out or losing weight, or more than that, why do you have to lose weight? You have to be fit. You're not a model
No,
here or a zero figure.
but they have to
You are
lose weight
actors.
because it is filmmakers like you who want them to be read thin.
I personally don't ask them to be zero figure, because actresses don't have to be zero figure or they don't have to be thin. They have to be fit. They have to have the energy to act. In fact, when they're dieting so much, they don't have the energy to act. We are basically actors. And another main important point I would like to add here is, see, Amir Khan, in fact, for Dangal, he put on weight and he lost weight, but he has experts. He has experts, fitness trainers, and medical assistants. A lot of people like Tom Hanks for Castaway, and and a lot of other people have lost weight, and they have a lot of kind of assistants by their side, trainers by their side. But these TV actresses and who don't have all that, the medical assistants or medical advice, this is what happens when watching by YouTube or dieting by internet. This is very important, and there should be some stringent law towards this. Like doctors should be accountable, and of course, actresses who are so young and who can't take decisions for themselves, there should be some kind of panel before going under the knife or before losing weight.
Two more callers. Two more
Sorry,
callers. Give me a minute. Two more callers. Krishna is calling us from Chennai, and then we'll go to Somnath from Kolkata. Yes, Mr. Krishna, go ahead, please.
See, what he said is, one part is right. You don't do hard work. You just want a shortcut method to do things which is going haywire. You know, most of the people now who are in the age of 20s and all this, I don't know, like why they have this fear phobia of, you know, I'll put on weight, I want to be zero size and all this. You do swimming, excellent exercise for your whole body. You have a proper diet, it's very good natural thing. You do yoga, it's a very good breathing exercise. You know, mental strength, everything. You see actors, okay, in case if this girls wants to have a person like a Rekha or someone like that, they did hard work like a yoga. You see Hema Malini ji and all. See, they might have gone through liposuction or something, we don't know. But the thing is like, whatever you can withstand, your body should withstand, your muscles should be there perfect. You know, your mental strength should be there. Only those people should
make an informed choice. Essentially, what you're saying is make an informed choice, know what you're doing. In most cases, these young people have read of WhatsApp, read of Google, seen something on YouTube, which is what Chetana did, and walked into that clinic in Bangalore. Thank you very much. Somnath is calling us from Kolkata. I think that's the last caller we'll be able to take. Somnathji, please go ahead.
Yes. See, first of all, my heartfelt condolence to the family of this actress. And second thing, you know, I mean, in all these metro cities and semi-urban cities, there's a lot of cosmetic clinics are coming, and they are using fillers, Botox, whatever. I have seen homeopathic doctors. They are not supposed to inject. They are injecting. And I think government should look after them, because there should be a regulatory board from government. It should come to take care of these clinics, cosmetic clinics. And most of the doctors are not qualified. Dentists, MDs, BDs, homeopaths, Ayurvedic people are doing injecting, you know, fillers, Botox, what not. And this kind of things are happening. Now, because of actress, it has come. There are many problems and complications are coming. I know personally. Okay. Please, I request government to come out some.
And you